We are at the HACSU 2024 Delegates Conference with another keynote speaker, Ella Haddad, the new Shadow Minister for Health for Labor. Thank you for joining us.
Thanks for having me.
Now, how long have you had this role?
Just since the election, yeah. So we had a reshuffle just after the election, and I've been responsible for Shadow Health, Mental Health, Disability, Community Services, Equality and Multicultural Affairs.
That's a lot on.
Yeah,
yes.
It's a lot of portfolios, but it's a very neat mix, I think, because community services and acute health services are so reliant on one another to successfully operate that I feel like it's a very good mix of portfolios, and I'm very passionate about health and public health and community services. Yeah.
And how did you feel when they said, we want you to take these portfolios? Because I guess they all do kind of overlay. So
they do.
Yeah.
I'm pretty daunted at first because I know what a big challenge it is. The health system has been suffering under 10 years of mismanagement and lack of priority from the Liberal Party. I really don't think it's front and centre of their minds when they're building policy, but I do have a background working and volunteering in health and community services with Women's Health Tasmania, with TASCOS, which is the peak body for the community services sector here in Tassie, and on the AIDS Council board. So I've got a real passion, even though I don't have a clinical background, I've got a real passion for health and community services and people getting the services that they need, in particular preventative health services, things that actually can start to reduce the chronic disease burden that we have in Tasmania and see people not get so sick that they need acute health services, but actually get what they need when they need it and early.
Having a look and assessment at the healthcare system at the moment in Tasmania, what is your assessment of that?
It's really, really tough. It's, workers like the delegates in the room here that we're seeing today who are actually at the front line and at the coalface of seeing how under-resourced and how stretched the health system here is in Tasmania. They are pulling money out of it year on year. I worked in the old Department of Health and Human Services when this government first got elected, and they started ripping out money in that financial year, and they've done it every year since, but this year's the worst. They're going to be cutting $600 million out of health over the next 4 years. There's no way for them to find those savings without reducing staff and services, and that's going to make a really horrible impact on workers that are already working in a system that's really, really stretched and under-resourced.
And speaking about the delegates in that, it's the first time that HACSU's done this, and I loved it, but giving the delegates a chance to ask you the questions, because I think so many times they keep saying this stuff, but they don't feel it. Yeah, they don't feel as though a lot of politicians are listening.
You know, I'm also a union member. I know how passionate union delegates are around fighting for the rights that we need in the respective workforces that unions represent. But what I would say is my personal way of building policy is that you have to actually talk to the people who are affected by that policy to build the best policy environment, the best health system, or whatever area that you're working in. You can't actually do that as a politician if you're just sitting in a room thinking up ideas. You need to be talking to health workers, you need to be talking to consumers of health services in the community about what's working, what's not working, where can we actually improve the system. That's when you actually land on good policies that make our system better.
You did say in that Q&A with the delegates too that you want to hear from them.
That's right.
And that you have an open door policy. How will you facilitate that? I guess for anyone that's even watching this, we have over 400 delegates across the state and 11,000 members. Yeah. What can they do if they have an issue, even if they want it to remain confidential?
And that happens all of the time. People do actually reach out to me, and I am able to share their stories while protecting their identity in Parliament. And I've always been acutely aware of that. People are welcome to contact me directly or through the leadership at HACSU or through delegates, whatever feels most comfortable for them. But I want to hear those coalface stories, because it's those experiences that are actually going to inform me if I ever do have the opportunity to serve in government. They're the stories and they're the experiences that are going to inform the policies that we bring to government when we do form government one day.
What do you make of, and I know it's quite early to tell, but Jackie Petrusma's now taken over as the Health Minister. I know a long time ago she was a nurse.
I've actually got really high expectations of Jackie Petrusma as the Health Minister. I'm going to make it clear to her that I expect good things from her, because she is the 5th Health Minister they've had in 5 years. It's been a revolving door of Health Ministers, which is really destabilising for the workforce. She's the first one that's got a background working in the health system, so she would understand it better than others who have come before her. But that puts the pressure on her. The first thing I did when she became minister was call on her to reverse the cuts and get rid of the vacancy control board that Guy Barnett put in place. She's been a health worker. She would understand how serious it is to be cutting staff at a time when we need them more than ever. So I'm going to put the asset on her as the new minister to make sure that she does better than her predecessors and reverses the budget cuts and gets rid of the vacancy control.
And I know one of the first things you did as well is when you became Shadow Health Minister is you spoke with Robbie Moore, HACSU State Secretary,
Yep.
and that conversation, you're still going to kind of work together in raising these issues in Parliament?
Absolutely, and it goes to what I said before, like I'm not going to be able to build good policy without talking to the leadership at HACSU and the delegates and the members and the workers. So meeting with Robbie regularly is a priority of mine because I know that he's got years of experience representing workers in the health and community services sector. We've got a lot of shared values and a lot of shared passions about that, and I'll be working closely with Robbie and with HACSU members to make sure that those experiences are reflected in our policies.